Hi, my name is Richard, and I'll be going over tracheal suction technique. Um, so for suctioning, there's really no doctor's orders. It's PRN. It's per the patient's condition or the policy of your institution. Um, Before performing the procedure, you're gonna review the patient's charts, and you're gonna look at vital trends, previous time that the procedure has been done, um, pertinent information like infections that could be there, the coca of the sputum that was produced. That's color, odor, consistency, and amount. Um, and you can look at contraindications. And there's really no contraindication other than ICS, which is a potential increase in intracranial pressure. Uh, we can also look at the patient's chart, the patient's ET size, trig size. I mean, so we're going to look at that. We're going to grab one of the actual size and one lower, just in case there's a documentation error, and it can be there just in case it's an emergency. You would also look at the catheter size, and you would use that to grab that particular kit. And you would normally go into that room with two kits. The kits are only good for two suction attempts. If more suction is required, you're going to need a second set with you just in case. Um, the in terms of the size of the catheters for trach tube, trach catheters are shorter than endotracheal catheters, simply because you have a much smaller distance to go. So you're basically removing a bunch of distance. So your your trach catheters will be much smaller. Once you have your equipment gathered, you go ahead and knock on the door. Introduce myself. Hi, my name is Richard. I'm with respiratory care. I'm a student. I'm going to be doing suction to remove some of the secretions from your lungs and help you breathe a little bit better. Um, may I have your name and date of birth? Just double check with your wristband. All right, thank you, Ms. Brown. So I'm going to be checking on a safety check on the room. In the room, you're going to want an arburator at the head of the bed, and the arburator helps reinsert the trach tube in case it gets decannulated. And you're going to also check a safety check on the ambu bag. 3-step check on the ambu bag. So ambu bag, you should be able to occlude the front, and it should remain. You shouldn't be able to deflate it. If you do deflate it and occlude the end, it should refill by itself. And you can also say the function of the one-way valve, the duckbill, to make sure it opens and closes. And within the room, you're also going to want a mask, and that mask is going to help you bag the patient in case the cannula is accidentally removed, which in this case you're going to cover with gauze and tape, and then bag the patient until it can be reinserted. All right, ma'am. So I'm going to take some vitals, okay? I'm going to listen to your lungs and check out your saturations. So this is called pulse ox. This is going to check your oxygen and your heartbeat. Thank you. And with your permission, I'm going to go underneath the gown, okay? Just going to listen to your lungs just to make sure we actually need to do this for you. All right, thank you. So I do hear coarse crackles. It is an indication of doing a suction. So, ma'am, there is a complication to this one. This will help you breathe better, but it could potentially cause you to be lightheaded. It could simulate your gag reflex, so you might cough or vomit. But we're going to be here. We're going to monitor everything. You'll be fine. Okay. you will make sure you're monitored and okay. All right, thank you. So prior to doing the procedure, we're going to oxygenate the patient. We're going to do this for at least 30 seconds. We'll set the FiO2 to 100 and set the flow meter to the appropriate distance or length. We're going to check the catheter, I'm sorry, the suction. There's usually a Yankauer right over here. That it is not, that's okay. Turn on the vacuum and you can occlude it just to make sure it's working properly. And you're going to want to set your pressure according to the patient. So adults is between 120 to 150. For children, it's 100 to 120. For infants, it's 80 to 100. And you gotta make sure it's an appropriate size. So once that's done, let me go ahead and set this right over here. Patient has been oxygenated. I'm going to remove this. I'm just going to put it to the side a little bit so we're out of the way. It's going to be right here for you, okay now? So with your permission, I'm going to use your table, okay? I'm going to wipe it down. I'm going to use it as a work area, so I'll have my equipment. All right, thank you, ma'am. So I'm going to wipe down the table. Also with me, I'll be bringing a saline tube, saline water, just to clean up the suction tube after the procedure. So as I mentioned before, it's usually two. I will be using one right over here. We open it up once we clean the surface. And this is a sterile procedure. And we go ahead and open it up. The gloves and disposable. Lift it up and move away from the field, sterile field. So in this procedure, you're gonna, as I mentioned, sterile. One hand will be sterile. That's gonna be touching the catheter, and one hand is for the actual suctioning. All right, now I'm gonna get ready, prepare. Okay, so this will be my clean hand. Pick up the suction tube. This will be my sterile hand. Push this up. Inserting that inside here. I'm going to remove the catheter itself. I'm going to hold it away from the patient. Alright, so this is the catheter. I'm going to go ahead and apply it on the inside, alright? So as I mentioned before, it's going to probably cause you to cough a little bit. Everything will be alright, okay? We're going to watch you. So go ahead and insert. Until limit resistance, and then we'll do this intermittently, pull back, and then occlude this to create the vacuum. Do it in a circular motion, and pull back, back, then away. Ma'am, are you feeling okay? Do you think you might need more? No, are you okay? All right, thank you, ma'am. So if the patient is has been cleared and don't need to reply, you can dispose of the product, dispose of the catheter. Otherwise, you would re-oxygenate the patient for 1 minute before going through the whole cycle again. So I'm going to dispose of this. Put this right here. Dispose of that. All right, so you feel better? So the purpose of this whole procedure is to kind of open up your lungs, remove some of the gunk that's kind of blocking your airway, and make it patent, make sure you can breathe properly, and also to kind of collect some specimens just in case we need to run it through the lab. All right, so I'm going to listen to you once more. We're going to check your oxygen. And listen to your lungs. I'm going to go underneath your gun once more, okay, man? All right, you sound much clearer. Thank you, man. So also, the saline water. We'll be putting on new gloves, actually. Each time we do this, we're going to make sure we get the new gloves on. And also, we're going to go ahead and suction some of the saline water with the vacuum tube, and that's to clean out the tubing. Once that's complete, and go ahead and clean up the job site, dispose of everything, reposition the table to the patient's preference. Ask, make sure they're okay. Are you okay, ma'am? Do you need anything else before I leave? You need blankets, anything? You have your call button right over here. If you need to give us a call to buzz me, go ahead and please do that. We'll be right back in, okay? I'm going to take this back. Thank you, ma'am. I'm going to put back your oxygen in as well. And also, we're going to reset the flow meter and the oxygen in the proper setting as before. We're going to leave the room. Hand sanitize, dispose of your gloves, hand sanitize. And go ahead and chart. And again, you're going to see how the patient did. You're going to look at the COCA. Again, color, order, consistency, and amount. Take a note of that. And that's it. Thank you for listening.